Good morning, sir. How are you today? Good, thank you. I'm Jake Cassell. I'm going to be your nurse today. So I just finished washing my hands. I'm going to go ahead and just put on some gloves, but I want to let you know that we're here today to have a nasal gastric tube placed. That procedure basically is being ordered by the doctor because of the complaints you've been having of increasing abdominal pain, and you've been having that emesis with some distension in your stomach. So we're going to go ahead and insert that tube today, okay? So let me go ahead and just make sure you are who you are. Go ahead and say your first, last name, and your birthday for me. Perfect. Okay, so basically, like I said, we're going to be doing this procedure today. At any point recently, have you had any chronic nosebleeds? Any allergies to any medications that I need to know about? Okay, great. No, you've never been told you have a deviated septum? Okay, awesome. I'm just going to go ahead and, if you don't mind, just look in your nose real quick. You don't have any problems breathing through either side of your nose? No? Awesome. Okay, and then just real quick, I'm going to look in your mouth. No oral or nasal trauma noted. Great, so then there's nothing that I see that's really making me worry about putting this NG tube in, so we're going to go ahead and start getting along with that. Real fast, I'm just going to go ahead and fill your stomach. Let's see. Yeah, you definitely feel distended. You having some pain right now? Yeah, a little rigid. Okay, and I'm normally I would listen before palpating to the stomach so that I don't activate peristalsis or anything like that. I'm going to listen to all 4 quadrants of the stomach, starting with the left upper, for about 10 to 15 seconds each. Okay, all 4 of your quadrants actually are lacking bowel sounds, so I do not hear bowel sounds right now, which again is partly why the doctor ordered this procedure today. Okay, so I'm gonna go ahead and gather my supplies. Just one more thing, I know you know your name. Do you know where you're at right now? Yes, correct. Do you know what time of day it is? And do you know what brought you here? Okay, perfect. So you are alert and oriented as far as I can tell, which is great because we need you to be for this for this procedure. Okay, so first off, I'm going to go ahead and sit you in the high Fowler's position. I'm going to go ahead and, just because this may get a little bit of fluid on you, I'm going to go ahead and put a towel down across your chest, okay? And that high Fowler's is above 30 degrees. Okay, so I'm going to take some warm water and a washcloth and go ahead and just clean up your top of your nose, because I'm going to be taping there. Just clean up around your mouth, clean up around your nares. Okay, perfect. Okay. So looking at this, it looks like your left nostril is a little bit wider. So I'm going to go ahead and use your left nostril, the closer one to me. So because this is a procedure where the tube is going to be going into your nose and straight through into your stomach, I have to make sure I have the right length. So what I'm going to do really fast is I'm just going to put this against your face and measure, okay? From your nose to your earlobe and down to your xiphoid process. There we go. Okay, I'm going to tape that spot so I know exactly where to stop whenever it comes to the insertion. Okay, got my spot taped. Perfect. Okay. So at this point, what I'm going to have you do is I'm going to actually have you lean your head forward. And, perfect, just tuck your chin. Great. Okay. And what I'm going to have you do is, while I'm pushing this through into your nose, I'm going to actually have you drink this water, okay? I'm going to have you swallow while I'm doing it, because it'll actually help for the tube to go down quicker. All right. Let me just get my supplies all ready. Okay, so I'm going to go ahead and lubricate this so that it goes in nice and easy. I got my lubrication here. Okay, this tip is nice and lubed. I'm going to go ahead and basically what I'm going to do is I'm going to advance this tube, aiming down at you, down towards the back. Here we go. And then if I feel any resistance or anything, I'll pull back a little bit, but I will try to get this in without any kind of resistance met. Okay, so I'm going to go ahead and start pushing this. I want you to start swallowing that water. Swallow sips of water, okay? I don't feel any resistance right now. Oh, nice, this is great. Okay, and gagging is normal, I'm sorry about that. Okay, so we got that on. I have a piece of tape, so I'm just gonna actually tape this to your cheek really fast, just so that it doesn't move around. tape is a little too big, so I'm just gonna rip it real fast. There you go. Okay, taped to your cheek. Okay, now that's nice and secure. So what I'm gonna do now is I'm actually gonna basically make sure that I'm in the right spot, okay? So what I'm gonna do is I'm actually gonna put some air into this tube while listening with my stethoscope to see if I'm in the correct place. So I'm gonna go under the towel really fast. Okay, perfect. Ready? Perfect. Okay, so I heard an audible air bolus, which is great. That means that, as far as I know right now, we are in the correct spot. Make sure that towel stays on there, okay? Another way that we actually can make sure that we're in the right spot is taking some of this fluid from your stomach. Here we go. See that stuff? That's your stomach, the stomach contents. I'm gonna go ahead and put this in a little basin for myself. And right now, I'm gonna use my litmus paper to test the stomach contents. I do have a color change, and it reads out at less than 5.5 pH, which is great. That's exactly what we expect. So right now, what I'm gonna do is I'm gonna go ahead and just make sure if we did have reason to believe that I did not put this in the correct spot, we would get an x-ray just to verify. But I do believe that we're in the correct spot, and at this point, basically what I'm gonna do is go ahead and I'm just gonna attach this correctly. So before I leave you, let me go ahead and, I have another piece of tape here already cut. And what I'm gonna do is I'm actually gonna tape this one to the bridge of your nose. And then I'm gonna wrap it around the tubing so that if for some reason during activity or during assessment or anything like that, if this were to get yanked, it's not gonna dislodge, okay? So now that I got that, I'm gonna go ahead and assess all your vitals really fast. Let me go ahead and do that. Go ahead and check to make sure that your oxygen's great, your heart rate, and all, blood pressure. Even check to make sure that you have adequate pulses, all that stuff. Once I make sure that all your vitals are within normal range, I'm gonna go ahead and document my procedure, make sure that all this stuff is put into the computer. I'm gonna discard all these extra supplies. And at this point, basically, I just want you to make sure that you keep your head the way it is right now, above 30 degrees if possible. There's a little dial right here that shows you what the degrees are on the head of your bed. Just keep it above 30 degrees for now, okay? And I will be back here shortly so that I can remove this, okay? See you soon. I'm gonna go ahead and do hand hygiene on the way out of the patient's room, and then I would go back and document. Okay, so now I'm walking back into the patient's room. I just performed hand hygiene, got some new gloves on. Okay, so how's it going? You feeling okay with that in there? Okay, so again, I know I already asked you, but I need you to give me your name, birthday, your name, first name, last name, and birthday again. One more time, Joe. Perfect. Okay, so basically, the order right now that we have is to remove the NG tube that I placed. Basically, the doctor got what he needed, and now we're gonna go ahead and take that out. So, again, I'm just gonna wash my hands one more time, just because I am gonna be touching the tube and things. I'm gonna go make sure my hands are washed. Give me 1 second. Wash, 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 wash. Okay, and I'm gonna go ahead and make sure you still are in your high Fowler's position, which is great. That's where I need you for this as well. At this point, what I'm gonna do is I'm just gonna clamp off your cord. Okay, so that's clamped now. And that is basically to ensure that nothing comes out of the tube at us or anything like that. Okay, so I'm gonna go ahead and disconnect if it's attached to suction or feeding or anything like that. And then I'm gonna go ahead and give myself a small amount of air into your tube. Here we go. Okay, so again, it's clamped now, everything's good. Okay, so this may be a little uncomfortable because I'm gonna have to take the tape off your face, so I'm gonna use an alcohol swab to kind of help me without getting anything too sticky. Okay. Okay. Alright, so the tape's off. Okay, so basically what I'm gonna want you to do, I'm gonna pull this out fairly quickly. I want you to go ahead and hold your breath when I tell you, and then I'm gonna go ahead and pull it out, okay? Ready, 1, 2, 3. Good job. Okay, I'm inspecting the tube. It doesn't look like there's anything wrong with the tube. It doesn't look like there's any blood or anything that's indicative of trauma. At this point, I'm going to go ahead and remove all this, throw my tube away, and all my supplies that I don't need. I'm going to rewash my hands, make sure my hands are nice and clean. Okay, sir, so I'm going to go ahead and provide you really fast with a little bit of oral and nasal care just because I did have that taped to you. I'm going to make sure that your nose is clean. Do you feel like you need to blow your nose at all? No? Okay, how about your mouth? Do you need a little, do you need one of those sponges to kind of moisten your mouth? You want some water? No? Okay. So basically, at this point, all I really have to do is go and document all the work we just did. I'm going to let the doctor know that basically this is gone now, and if at any point from this point on you start to feel nauseous or you start to have any kind of discomfort or anything like that, make sure you just hit your call button, okay? It's right here. I'm going to put it over your shoulder. Here's your call button. Again, my name is Jake. I'm going to be your nurse for the remainder of the day. If you have any questions for me, just let me know, okay? And by chance, do you have to go to the restroom right now? Do you need any possessions of yours or anything like that? Okay, you're in any pain right now? You're comfortable? Okay, awesome. And yeah, if you need anything, just let me know, okay? Thank you.